There have been voices of discontent in the health sector workforce following the devolvement of healthcare services, with players in the sector cautioning it will not be business as usual if the government fails to deal with the question of salary delays and non-payment of allowances.
On Monday, if there will be no pay, no work, but we'll stretch it further. And in the next 2 weeks, if we don't have a permanent resolution, we are doing a mammoth strike and will not have cessation until every single issue we've raised has been dealt with.
The health workers' leadership are pointing an accusing finger at the county government for failing to manage healthcare functions due to lack of capacity, despite their persistence in demanding the devolution of healthcare services.
All hospitals are being told, if you collect money, give it to the governors and the MCs, then they decide what to give you. Consequently, all the money goes to the county government and nothing goes to the hospitals. So there are no supplies. And then the governors want to pass the buck. You cannot pass the buck stops with you. You can't then say, healthcare is not working, it's not my fault, it's the health worker. It's not the health worker's fault, Mr. Governor. If you chose to be governor, if you chose to take care of healthcare, it is your responsibility. You cannot pass that buck. Take charge or ship out.
Victor Nganyi, the chair of the Kenya Medical and Dentist Union, accused the section of political leaders of playing politics and ethnicizing the health sector structure, further crippling service delivery in the counties.
Zoom is in half the counties. Kama utoki katika county hii, hautaweza kupata promotion. Daktari ambaye ako senior kabisa, muuguzi ambaye ako senior kabisa, ananyima promotion kwa maana wewe ni kabila tofauti. Wewe hautoki katika county hii. Wewe sijui haujui MCA UP. Wewe haujuani na governor, una support party fulani. Tunasema afya sasa ni ya kabila fulani, ni ya county fulani. Hatuwezi tukafanya biashara namna hiyo.
The Nurses Union Secretary General Seth Panyako alleged constant political interference and even bullying by a section of county assembly members with a view of intimidating health workers.
Security and education are key pillars of any nation. And there is no president in the world who can just keep a deaf ear on a sick nation. You cannot be a president of a sick nation. Kenya is sick. The healthcare system has collapsed. And that's why we are saying, Okoa, Afya movement imeanza na haturudi nyuma.
At the same time, they are threatening to support CORD's push for a referendum if the government fails to address their welfare concerns. Healthcare workers have on several occasions expressed welfare concerns, prompting the National Assembly to pass a motion seeking to have healthcare services reverted to the national government until such a time when counties have the capacity to handle health issues. Caroline Kamau reporting for Channel 1 News Hour.